Hi, good afternoon. I just wanted to share my experience and outcomes with the MEL 90. No financial interest. So my wish list for a refractive platform, I started very late, quite in 2017. So yeah. So it started in 2017, and my wish list for a refractive platform just stood for versatility. Should have newer technologies, good optics, ease of use, less recurring cost, sturdy, and excellent service backup. So I had all the machines to choose from, and I chose the MEL 90 as it fit most of the criteria which I needed. Ultra fast laser, flying spot, just the right spot size, topo-guided treatments available, femtosecond link, and presbyopic corrections. So the cutting edge technology which I really admire were the FlexiQuence function, which is the dual frequency, it is the only dual frequency laser in the world, and a fast eye tracker, advanced ablation algorithm, and in the past 5 years, I have not had a single breakdown. My preferred correction range is 8 to 9 diopters of myopia. I have corrected up to 5 diopters of hyperopia and astigmatism up to 5 diopters. Why the dual frequency laser? We need the ultra fast speed for LASIK, and that is the 500 hertz. So you get a even faster than the EX500. We get it 1.3 seconds per diopter. And why 250? Because you want to avoid thermal loading in PRK. And it is published that a 400 hertz laser versus a 200 hertz laser, there's a 46% of haze in the 400 hertz and 30% in 200 hertz, which is, I think, quite significant. Also, the advanced ablation algorithm is excellent for corrections of high cylinders. It saves tissue and it is aspherically optimized. Now, why cyclotorsion? Cyclotorsion is very important when even 5 to 7 to maybe 8 degrees, if you are off the axis, you can induce considerable residual astigmatism. There are two ways of cyclotorsion compensation in MEL 90. One, you can do a manual marking, and then there is a red line which you can project onto the cornea by the machine and align the marks, like you do for any toric IOL. The results are extremely good. I have been doing that. You have an automated Z-align, and also now with the IOL Master 700, there is very soon it will be integrated like in the VisuMax. And we know that manual limbal markings are equally effective as iris registration software, which is already published for cataract surgery. My results, I'll just share you a part of the results from our center. 1047 eyes, 51% males and 49% females, 98.5% patient satisfaction, and 96% with PRK, mainly due to recurrent visits and more longer use of medications. However, my focus is now slowly shifting from, I was doing around 20% PRK in the beginning, but now I'm slowly going to 50% PRK and 50% LASIK, seeing the brilliant results of PRK, which I have got. And if you see our experience with the final uncorrected visual acuity, 96% overall, 99% for LASIK patients had 6x6 vision, and 93% for PRK. And if we include the 6x6 partial, it is 98%, so very close to LASIK, the blade LASIK. And PRK is rapidly becoming my preferred technique because of the advantage of least risk of ectasia, no flaps, so no complications, cost effective, best focus of the aiming beam, which I get, and very good visual recovery 2 to 6 weeks post-treatment. Of course, I do it with mitomycin C and with modeling with steroids, and of course, it takes longer medications, but in the end, both patients are equally happy. The main disadvantage is, of course, post-op pain, frequent follow-ups, and longer duration of topical treatments. I'm extremely happy with the use of the Moria SBK 1 use plus microkeratome, and I've had very low complications, just 5 complications in these 5 years, with nearly 1,000 eyes. So invest wisely, especially in the post-COVID scenario. PRK has a bright future in my refractive case preferences. Zeiss has the most comprehensive and upgradable refractive platforms as of today. You'll have to price your refractive procedures in these times attractively to achieve viability, and excellent results and commitment to quality alone triumphs. Thank you so much.